video we'll discuss about spondylosis. What is spondylosis? Spondylosis means vertebral arthritis. It also known as degenerative arthritis or degenerative disc disease. Degenerative arthritis of the joint between vertebrae. It's narrow the neural forearm. It pinches that nerve is causes reticulopathy. So spondylosis means vertebral arthritis. It having other name degenerative disc disease. It is a condition characterized by the breakdown of spinal disc and vertebrae, leading to pain, stiffness and nerve compressions. Next, pathophysiology. It involves a cascade of changes. First one is dehydration of spinal disc space narrowing, increased stress on vertebrae and facet joint. So what are the pathophysiology? Dehydration of spinal disc space narrowing, increased stress on vertebrae and facet joint. This can result in osteophytes. Osteophytes means bone spur formation, then ligament stiffening and nerve root or spinal cord compression. So these are the things will happen. Result of because of this reason osteophyte that formation, then because of that ligament stiffening and nerve root or spinal cord compressions. Pathophysiology, first point, disc degeneration. The intervertebral disc acting as a cushion between vertebrae. So what is the function? It acts as a cushion between the vertebrae. Loss water content. Here it lost that water content and flexibility with age, because of age. So this process is known as disc desiccations. Causes the disc to narrow and lose its shock absorbing capacity. So here what will happen? The intervertebral disc acts as a cushioning between vertebrae. So here water content lost because of aging, flexibility also decreasing. So because of that it become narrowing and lose its shock absorbing capacity. So this one is disc degeneration. Second point, increased stress. Disc space narrow and more stress is transferred to facet joint. It is located back vertebrae. So here disc space narrow, more stress is transferred to facet joint. So because of increasing stress can leads to facet joint osteoarthritis and bone spur formation. That means osteophytes formation, bony growth formation that can encroach on spinal canal and neural foramina. Then ligaments stiffness. Ligament that support that spine can also become stiff and less flexible with age, contributing to reduced range of motion and potential nerve compression. So ligament stiffness, here ligament support that spine can also become stiff and less flexible with age. This one contributing to reduced range of motion and potential nerve compression. Then nerve compression, the narrowing of that spinal canal and neural foramina due to disc degeneration, osteophytes formation and ligament stiffening can compress the spinal cord and nerve root, leading to symptoms like pain, numbness, tingling and weakness. Next, what are the types of Spondylosis, what are the types? Cervical. Second one is thoracic. Third one is lumbar. So here changes in disc and joint of neck. Here changes in mid back. So this one will affect our lower back, mainly leg region. So it will causes pain, headache, arm weakness and numbness. Thoracic one will affect mid back. Lumbar will affect lower back, pain into the leg. Next, what are the causes of spondylosis? Primarily caused by natural degeneration of spinal disc and joint over time. Because of aging, that spinal degeneration will happen. Then herniated disc, weakened disc wall can allow the inner gel-like substances to bulge out, pressing on nerves and causing pain. Then bone spur. This one growing bone spur, growing bone growth. Then stiff ligament can also stiffen because and become less flexible with age and contributing to spondylosis. Then spinal injury. Past injuries because of fall or car accident can accelerate the degeneration. Then poor posture, maintaining poor posture for extended period can put extra strain on the spine. Then repetitive movement, because of occupation or activities that involve that repetitive movement or heavy lifting can also contribute to spondylosis. Obesity, sedentary lifestyle, smoking and genetics. So primary cause because of aging, that spinal disc degeneration, joint degeneration will occur. Then herniated disc, that means inside the gel substance to bulge out. Bone spur, stiff ligament, spinal injury, poor posture, repetitive movement, obesity, sedentary lifestyle, smoking and genetics. These are the causes for spondylosis. Diagnosis through a combination of this one physical examination, imaging test and nerve function test. In physical examination, what are the test means? Range of motion assessment, movement assessment, then reflex and muscle strength testing, and gait analysis, how you walk. All the three things: range of motion assessment, reflex and muscle strength testing, and gait analysis. Then imaging technique, three tests: X-ray, MRI and CT scan. Then no function test, electromyography and no conduction studies. Then treatment, physiotherapy, analgesic, non-steroidal anti-inflammatory drugs, muscle relaxant, steroid, narcotic and local anesthetic, spinal surgery, microsurgery. So these are the treatment. Physiotherapy we want to follow. Then non-steroidal anti-inflammatory drugs, muscle relaxant, steroid, narcotic and local anesthetic, spinal surgery and microsurgery. Video studied spondylosis pathophysiology. In this one, disc degeneration, then increased stress, then ligament stiffness, then nerve compressions, then three types: cervical, thoracic and lumbar spondylosis. Then causes of spondylosis. Then diagnosis, physical imaging and nerve function test and treatment. Thanks for watching.